Good morning, everyone. I'll be presenting before you analysis of retinal nerve fiber layer thickness in patients of Alzheimer's disease. Alzheimer's disease, a neurodegenerative disorder, is the most common cause of dementia in the elderly. It presents with an insidious onset of memory loss followed by a slowly progressive dementia over several years. Mild cognitive impairment is considered as the prodromal stage of Alzheimer's disease, in which memory loss falls 1.5 standard deviation below normal on standardized memory tests. Recent studies have shown that neurodegeneration also involves retinal ganglion cells and their axons in the optic nerve. On HPE, lesions associated with Alzheimer's disease like neuronal loss, neurofibrillary tangles have been found in the neuroretina also. Until recently, the diagnosis of Alzheimer's disease has been on the basis of symptoms neuroimaging studies like CT and MRI and CSF evaluation, which shows no specific changes, especially in the early disease. OCT, being a non-invasive technique for the measurement of peripapillary RNFL, has been proven useful for detecting significantly reduced retinal thickness in patients of Alzheimer's disease. So the aim of our study was to evaluate RNFL thickness in patients of Alzheimer's disease using STOCT. This was a prospective cross-sectional study that included eyes of 32 diagnosed cases of Alzheimer's disease and control group, which consisted of the eyes of 32 patients visiting OPD for routine eye examination. Patients diagnosed with Alzheimer's disease by MRI findings and MMSE and best corrected visual acuity 612 or better were included in the study. Patients with other known diseases affecting the optic nerve with unclear media, optic disc anomalies, or history of IOP elevations were excluded from the study. Both cases and controls underwent detailed ocular examination, including measurement of BCVA, slit lamp examination, IOP measurements, CCT, and fundoscopy. All subjects underwent OCT scanning for measurement of peripapillary thickness. In our study, both the groups have slight female preponderance, 64% in the Alzheimer's disease group and 55% in the control group. There was no statistical significant difference between the AD group and control group in terms of age. In the AD group, 59.3% patients had abnormal RNFL thickness and 40.6% had normal RNFL thickness. On comparing the mean RNFL thickness between the AD group and control group, we found that AD group had significantly reduced RNFL thickness when compared to the control group. On comparing the RNFL thickness in different quadrants between the AD group and control group, we found that there was a decrease in the RNFL thickness in all the quadrants when compared with the control group. The age difference between the two groups was not statistically significant. Leon et al. In their study found that average RNFL thickness was significantly decreased in patients with AD. Similarly, in our study, the average RNFL thickness in AD patient was found to be significantly less than that of the control group. Liu et al. In their study have shown that RNFL thickness of superior and inferior quadrant to be reduced in patients of AD. In our study, the RNFL thickness of AD patients in all quadrant was thinner than controls. However, the thinning was statistically significant only in the superior quadrant. So, RNFL measurement by OCT can be used as an early and important tool to aid the diagnosis of AD. Additionally, RNFL thickness changes can be used to monitor the progression of Alzheimer's disease. Demonstrating progressive thinning of RNFL over time can be critical for validating OCT as a viable biomarker for patients with Alzheimer's disease. Thank you.
Okay,
What
you
was
said
the
that.
cause for thinning of the superior RFNL defects in your cases?
Ma'am, we could not actually correlate why there was only in the thinning was in all the quadrants, but statistically
Statistically, it was
significant only in the
significant.
superior quadrant. In previous studies, there was we have seen that there was thinning in only superior and the inferior quadrant. Not thinning was not found in other quadrants.
But you couldn't reason it out.
No.
So you said that RNFL analysis can help in diagnosis, but in your series they were already diagnosed cases.
Yes, sir.
So how do you infer this?
So in our study, patients were already sent from the neurology OPD. They were
No,
already
that's okay, that we know, but how do you make this conclusion that it can help in early diagnosis?
uh,
Actually, it won't help more in diagnosis, more for progression, and that also if you know the time period when you're going to call them, you have to assess them more prospectively.
If the physicians send early to the, if the patient's presenting with dementia, early dementia, if they refer to us and we can get a OCT RNFL, then we can at
So
least monitor the patient.
that makes it a different study
Yes, sir.
altogether.
Not in this
So
study.
on the basis of this study, you cannot say this is
Yes,
just a
sir.
review kind of a thing.
Yes, sir.